Hello and welcome. Southwest China's Chengdu city is seeing a COVID-19 rebound with 10 locally transmitted cases and 2 asymptomatic cases reported. In the hotspot Pidu, mass testing are being conducted. I'm right now at Sichuan Provincial People's Hospital here in Chengdu City to see how epidemic control efforts are being carried out here in this hospital. It's one of the largest hospitals in southwest China. And with me right now is Dr. Wang Wenyan, who's a cardiologist at the Heart Failure Center here at Sichuan Provincial People's Hospital. Welcome to the show, Dr. Wang.
Hi. Hello,
So,
everyone.
My understanding is that you're going to tour me through the hospital today to see the epidemic control purposes?
Yeah, just follow me.
Okay.
So here is the front gate to enter the hospital. At the epidemic period, we have very strict restrict to first of all, you need to hygienize your hand from this hygiene.
And so this is the automatic dispenser.
Yes, you know touching for that. Then here is the pathway get into the hospital.
This is where patients would enter the hospital.
We have the staff would be on the other side of the hospital. So we have thermal scan to monitor the temperature, the body temperature here, right here. You can see that. And we have staff to read the temperature of the body. And if
that's us.
of course you stay here, and you can see that.
36.2.
Yeah, so non spot, you know the temperature over there.
Right.
And if we find somebody have the history of epidemic from the epidemic area and also have the burning fever, then we get to the fever clinic over there.
We're gonna go to in just a little while the fever clinic. But what's this building that we're entering?
It's the outpatient department in the hospital. So we need to scan the temperature first and to pick out if the patient have running fever, then we'll be suspect to maybe have some nucleic virus infection. We will test the nuclear acid for the patient here. But the body temperature is normal, then don't get interested the whole of the outpatient department.
Right.
Yeah.
So this is where all patients must go.
All patients, yes, first.
And then I'm seeing that these patients are showing their health code, right?
Yes. Yeah. Now, first of all, you need to register because the beginning of the epidemic, all patients are asked to register on the internet.
Right.
There is no other spot register for here.
Okay.
And then he will show the register code and also the health code. And after the temperature measure, the normal can enter the department.
So should we pull out our health code now?
Oh, yeah. I think so. Sure. So you need to show to the staff the green code, then you can permit to enter.
Can you just show this to our cameraman?
Yeah, okay. Here, I'm green.
And here's mine.
Yeah. Right. No problem.
Okay, thank you. So basically, this is a mini app in China's omnipresent WeChat. It tracks your movements, right? Locations you've been to in the past 14 days or so.
If you have been to some high risk or moderate risk area, then the code will be shown in red, I think.
In red or yellow?
Yeah, red or yellow.
Right.
Then the staff will guide you to some place.
So medium risk, yellow, and then high risk is red, right?
Okay.
Ours are both green.
Green, safe.
So Chengdu now already has like 5 medium risk regions already, right?
Yes.
Most of them in the hotspot of Pidu County, Pidu District.
Yes. Pidu is one district in Chengdu city. But you know, Chengdu is a great city. We have so many populations here. So averagely, we enter the hospital to getting the diagnosis or the clinics rise so many patients here. So the staffs, the leadership in our hospital have been get some strategies to get rid of the patient not be gathered together. So first of all, we need to measure the temperature here. And the second, when the patient get into the clinic, they will measure the temperature again. And when the patient receives the clinic service, and the doctor or a physician will ask the patient the epidemic story again.
Okay. So I just want to take a moment to take in this outpatient department here because, well, this is a weekend afternoon, so the hospital should be less crowded than usual. But we're seeing very few patients at the registration windows. And you talked about online registration, online appointment before.
Right.
How many % of patients go through online appointment right now?
Now it's almost at 80 or 90% because according to our announcement and our to the Weibo broadcast, so the patient, most of the patients already have the WeChat, the number, so they can register online. So, but we still have some special gate for the elder person because they don't have
people who don't know how to use WeChat, who don't have smartphones. You have a special passage.
We still have some the gate or the window to survive such an elder person do not have the internet service over there. So to make sure everybody can get the medical service.
Right. That's very considerate. Wonderful. So what happens if a patient doesn't pass the thermoscan? What if his or her body temperature is higher?
That will depend. If the patient have the epidemic history, for example, he came from Pidu, the high risk or moderate risk of the epidemic, then he will be guided to the fever clinic to receive the nuclear screening or test and wait for the result. The result is negative, then we will treat the patient normally. If the result is positive, then we will confirm that, then we will be transferred to some public health center to receive the further treatment.
Right. So should we move on to our next stop? I do want to check out the emergency department.
The emergency department is a very important part or district in the hospital because they will encounter so many people who have very emergency situation to ask for very rapid reaction or treatment. So that will be a very quite burden for the such staff over here. So we need to see that what happened there.
Dr. Wang, I think hospitals are really on the forefront of this battle against COVID-19. Back in January, February in Wuhan, many medical workers were infected not knowing what this virus actually is. Do you feel threatened? Do you feel dangerous?
Frankly, at the very beginning, we know a little about this virus. Somehow we still have some concern about that. But as a physician, we have very profound medical background. We know how to prevent and protect ourselves through a very scientific methods or strategy. We protect ourselves. And on the other hand, I think our comrades or colleagues will fight against that. We have the strength to fight against all the epidemic in a very scientific way.
Right. Because people would think that you're from the heart department, that you're less exposed to this kind of infectious disease. But quite on the contrary, you don't protect yourself as people as medical workers in the emergency department or infectious disease department. So you're even more at risk, I'd say, conducting surgeries on patients. If you don't know that this person is infected, then you can very easily infect yourself. Is that so?
It's an issue. First of all, we at the clinic, we will wear some the protection for prevention. The second prevention, we will wear mask and the cap, and also some of the patient, some of our colleagues will wear the glasses to prevent or protect themselves. And the second one is if the patient, for example, the heart failure patient were admitted to the ward and hospitalized, and we will test the nucleic acid. If he or she the results the negative, then will be transferred to the inward. But if the positive, then we'll be transferred, I think, to a very isolated area to receive the very special treatment.
Safe. You feel protected.
Safe.
Okay. I see Dr. Zhang is actually waiting for us.
Yes, so he is from the emergency department. He is in charge of this area.
Dr. Zhang, welcome to the show. So this is Dr. Zhang Xiaohong, who's an emergency specialist here at Sichuan Provincial People's Hospital.
Hello.
And both of these doctors are going to take me through the emergency department of this hospital, which is the front line of the front line emergency department.
Yes, the front line.
Yeah. And so what's this saying?
Please show your healthy code.
Your health code.
And itinerary
Itinerary.
code. Yeah.
Tracker.
Yes.
Right. So
Again.
Oh, again, we need to show this.
Yes.
So every building you go into, you have to show the health code first.
Exactly.
Wow.
We have 3 layers.
It's not just once at the entrance and be done with it.
The first line
Right.
here. Because we have some people critical illness.
Right. I'm not sure if you guys realize this, but back on Monday when the COVID-19 cases in Pidu County just broke out, this platform collapsed because so many people were using it.
Yeah, I know that. I was told that the broke at the beginning of the onset of the first cases in Pidu.
It's just because of the information was so busy.
Right.
So many people are checking their health status
But
and their.
because we are not belong to that zero. Yeah, so we are just green.
Right.
Yeah. Okay.
So I think it's we should make it clear that we're now not at a medium risk region. Those are certain areas in Pidu District. We're now quite safe, right? Thank you. 谢谢.
We have the green light passenger for the critical illness.
Right. What does that mean? That basically means if a patient is in a very critical, life-threatening condition, then you have sort of a fast track for that patient.
Yes. Even at this situation, because we will initiate a very special, rapid crack for them. We will call some physician that belong to the other department here.
So what, in the worst case,
Yes.
if that patient happens to be COVID positive?
Yeah, it's possible.
It's possible. It's entirely possible.
Yeah.
So how do you, if you encounter in the worst situation a patient like that,
Yes.
how do you ensure the safety of the medical workers?
We will restrict that area, a limited area, and limited person to contact them. And we have the emergency owned testing area, and quickly we will disinfect here and transfer using the special equipment to the other.
Okay. So you will still test the patient as soon as possible?
We will.
Very sick people will, if we will be hospitalized, we will test the nucleic acid first. I think.
To keep the patient safe. At the same time, we will protect our staff and rapidly changing into the third prevention procedure.
Third prevention procedure. That's the highest level, the third level prevention?
The highest.
Right.
And we
what
will
is-
change our form even into that PPE.
So you're wearing first degree prevention equipment right now?
Right now, I'm the first
level.
only some cap and mask, a mask and a white gown, but over there.
So that would be a secondary
Yes. It's the gown is the isolation gown.
isolation gown.
Yeah, and wear some
Gloves?
Yes. And
Okay, so then a third degree prevention
that
would constitute
in fever
clinic would be
yeah.
right, would qualify for third degree prevention. Then medical workers would wear full PPE, personal protection equipment.
Sometimes here.
Here as well.
Yeah. Yeah, you can see here we have our
Oh, we're seeing emergency nucleic acid sampling spot.
the staff are working here. They are wearing the third. You can see. Yeah, the third prevention procedure.
Okay, let me go check out. Right, so this would be third degree prevention, full body PPE, personal protection equipment. 你好，你好，我们是电视台的 We're with China Global Television Network. Just checking your PPE， 看一下您的防护服。是老师们都跟我们在一起呢。
不，您退后，让你小过。
So this is no. You don't need. 所以这边是一个采样点是吧 ？This is a sampling spot. How many samples do you take every day? 现在的话，一天大概采多少？
一天啊，200多个这会儿。
一天
就是24小时嘛，你说的，就是200多个。
So okay, she takes about 200 samples within a 24-hour period. So 200 samples each day. 穿这个也很不舒服吧？穿这个防护
有点，就是夏天就是很热嘛，冬天又是很冷。
冬天很冷吗？
对，有空调有时候也不开了空调都没多大作用。
So she said this is the PPE is very uncomfortable because you get very hot in the summer and very cold in the winter because you can't feel the air conditioner anyways. 辛苦了，谢谢 ，Thank you. Thank you. So, okay, so
is very heavy.
Very heavy. 200 sampling. 200 samples every day.
Every day, and all in all, our hospital maybe it's 1,000 sample one day.
Overall, your hospital,
outpatient
plus
emergency, and
plus
the
fever clinic,
yes, clinic.
Altogether about
Altogether.
100 samples every
Yes,
day.
every day.
Wow.
To make sure that every admitted patient will take the test.
Every admitted patient needs to take the test. Wow. 1,000 samples, that's a lot. Is it because of the rebound in Pidu?
PCR test, only the PCR test.
Right. The nucleic acid test, right?
Yeah, less than maybe 4 hours.
Okay, it only takes about less than 4 hours to get a result?
Get the result.
Wow,
Yeah.
that's very fast.
But some are even faster than that because we can take the history of the illness and check the exam, physical exam, and do the CT scan and
CT scan is fast.
yeah, CT
But
scan.
how accurate is the CT scan?
Yes, I can say not so accurately,
Not so
because some virus illness, even some similar image as the same as the coronary virus.
Wow, okay. So because this is a very new virus,
In a very urgent or semi-urgent cases, we need to initiate that rapid quick
because it's faster, just because it's faster.
to keep the patient safe.
Right.
In that situation, we will put our staff in some dangerous situation, but it's worse because it's the balance.
But, I mean, the lives of medical workers is also lives, right? I mean, how can you have family members? How do you feel about
specialist we know how to protect us and how to protect the other patients.
Right.
Yeah.
You have more professional knowledge.
I remember I don't have the scare, the mission ever all the time. I feel very safe. Yeah. First of all, I think I can protect myself, and second, I know how to the way to protect from others' patient. I think.
Yeah. And we have that plan and to change the other staff to change if we are so busy or get tired. So we will change the staff.
Right.
Yeah, shift.
So Dr. Wang and Dr. Zhang, earlier we talked about the layers of protections at your hospital. I think for those countries who are still dealing with the brunt of COVID-19, they can learn something from this. So talk to me about how your hospital is containing COVID-19 by adopting this layer strategy.
I think maybe the crowd in Chengdu in our hospital is very large. So this is very necessary. We cannot measure every patient the temperature by our staff, I think. So the thermal scan is very important. So and also the temperature is also a very important sign of the nuclear 19. So that will be a strategy too.
Right. So if you have a fever, then we suspect COVID.
Right.
So that's the first layer?
They will straight some of the patients with the higher or favorable temperature, then will be guided to the clinic of the fever clinic. And the second one, I think that the patient get to the medical service in the clinic or outpatient or in the CT scan room or CT ultrasound room, then will be scared.
Laboratory. Yes, it's also dangerous.
Okay, so CT scan, ultrasound, labs are secondary, the secondary layer.
Right. And then in the inner hospital and the health center.
Radiologists. They belong to the front line that combating against the virus.
Right.
Yeah, they are here also.
Right.
But to keep the inpatient safe, so the last inner layer, we have more.
According to Chinese culture or traditional, if the family members, meaning in hospitalized relatives, will take care of the patient.
Right, they usually stay with the patient.
But in this epidemic period, we restrict the visitor or the health giver. So only one is permitted, and after the nuclear, the elective.
Okay, so only one family member or relative is allowed to stay with the patient.
Right. Yes.
For fear of transmitting.
Because when I'm doing runs every morning in the past, there would be crowd in the world, but right now it's clear. So I think I like that. I will be more safer and more quiet.
Right, because one patient, one family member, you're having fewer crowds here. Right. And just as Dr. Zhang just mentioned, that radiologists are also on the forefront of this battle against COVID. They're also heroes. My respects to medical workers who really made us feel safe, waited us through this difficult period of time. So thank you guys so much.
Thank you.
So this is in-hospital department.
The third building of the inner hospital, and then they have some surgical department, and have some the genealogy. Right.
So this would belong to the third layer of protection.
We still have the thermal scan over there.
So pretty high risk area already.
Right.
Right. Okay, and since you guys mentioned the fever clinic so many times.
The fever clinic.
Right. So anyone with a fever are directed to this part of the hospital.
Directly. And if the patient have epidemic history, he will be very high suspect of the coronavirus. Will get the nuclear test immediately.
So we can see that this is an entirely separate building, and it looks quite new. Has this been newly built for the COVID-19?
A new hospital. Because it has its own lab the own physician, even with the low limb.
So it's got
and get out.
So it's got its own physician, its own lab. You guys mentioned this is a hospital within a hospital. I think that's a very good way of putting it. So can we take a sneak peek from the entrance? Or is it too dangerous for us to go in?
Sure. Yeah. No contact.
No contact. Okay, so patients can get their nucleic acid test here in this building, in this separate building within this hospital. And
Isolated area.
okay, so we're seeing, and these would be patients waiting for their test results, right? We're seeing about 3 or 4 patients waiting here. What happens if their nucleic acid test results comes in positive?
According to our procedure, and the patient is test result is positive, they will directly transfer to our public health hospital. What is the hospital? That would be another one. I think it would be
transfer them to the maybe isolation room or negative pressure room.
Okay. Or a designated COVID-19 hospital.
But some, if he had the history of the epidemic and he got the syndrome, and we will immediately transfer with the negative shift, pressure shift equipment to the other hospital.
Okay. And how do you make sure that the virus doesn't spread during the transfer?
Because the equipment was so special, it will keep the air inside.
Okay.
Okay.
So negative pressure ambulances, right?
Yeah.
Okay. So I saw you washing your hands again. Should I do the same?
Yes.
Make it a habit, right? Make it a habit.
More than 15 minutes. A second.
And then if you wash your hands with alcohol too much, then your skin begin to come off.
that's the truth.
It's really painful and ugly.
So I need to rinse some head cream to protect my skin.
Right.
So, Dr. Zhang, you're with the emergency department. You're on the front line of the front line.
Yeah.
How do you also led a team to a county called Daofu back in February, which is a small county on the Tibetan Plateau, to combat the virus there, right?
Yeah.
So, what's your assessment of the current situation? Because we have 10 cases and 2 asymptomatic cases. Should it be a source of concern? Are you worried that a second wave is coming?
Oh, yeah. Because of the winter is coming, and because the virus is so special, I think that maybe next year, some specialists in this virology had some pre-false 预言 that maybe
predicted
predicted
that the virus were going to come back again this winter.
Maybe every winter.
Maybe every winter. Wow.
Maybe seasonal.
Maybe seasonal, like a flu.
That's not for sure, I think. But because we have experience back in combating against it, so we get some confidence to combat.
Right. So we're getting to know this virus more and more. We know who our enemy is now.
We know what we should do, and we need to compact every now. Just I want to see 严防实打. Every patient is very important to against.
So no one should be missed. Not a single case should be missed. And that's also the reason why that mass testing is being conducted right now in Pidu District, right? I think everyone there in Pidu District, which is a district of about 1 million people.
In some sense, I think that precaution is more important than the medicine.
Right. So preventative measures are more important than treating the disease.
Yes,
Right.
yeah,
Right.
absolutely. Yeah. and more effective.
Right.
Yeah.
So we're seeing that this is the Department of Clinical Laboratory. I do want to go check it out. But just before that, Dr. Zhang and Dr. Wang, some final words from you guys. What should the public do right now? Should they be worried?
No, because it has a separate room for the sample or for the staff, and you can see we passed the sample right window.
Right.
Yeah, and it will operate in some way, maybe 密封的
Airtight. So I mean the mass public here in Chengdu, or even all over China, because we're seeing a small rebound right now.
Yeah.
I just want to get some final thoughts from you. Should the mass public, the general public, should they be worried right now about their safety?
No panic, no worry anymore, because we have the government, we have all these people. They know how to treat them, how to against them,
and experience from the first round.
Yes.
So some final thoughts from you, Dr. Wang?
No panic, I agree. Because first of all, our government have a rapid reaction to isolated the moderate or high risk area in Pidu area in Chengdu. And second, we have so many strategies to prevent the transfer or infections of the COVID-19. And third one, I think even the have some epidemic rebound, we still have our strategy to know the professional way to protect our mass of the population.
Right. So in summary, no panicking. We have a system in place to deal with this virus. No panicking, but take preventative measures. Wear masks, wash your hands, right? Okay.
Yeah, wear masks, wash your hands.
Okay.
I think that the most important thing is the government theory, policy to put them at the beginning, put out of them at the beginning.
Right.
Yeah. You can
Prevention.
see. You can see the curve last year is higher, and now you can see the curve is just flat.
Flattening.
Yes. So.
So maybe each time it rebounds, it's going to flatten even more as we get to know the virus more.
Oh yeah, it's very different than before.
Right.
Yeah.
So thank you so much both. This is Dr. Zhang Xiaohong, who's a emergency specialist here at Sichuan Provincial Hospital, and this is Dr. Wang Wenyan, who's a cardiologist here at Sichuan Provincial People's Hospital. Thank you both for joining the show. I had a wonderful chat with you.
Yeah. Thank you.
But right now I'm going to go check out the lab. So I'll catch you guys later. Bye-bye. Thank you. So if all goes well, I think Dr. Huang Yi is going to wait for us at this Department of Clinical Laboratory. This is a fairly new lab, and I just get my cameraman up the step because it's quite high. So this is a newly built lab that's still not in use yet. And some preparatory work is going on to get this lab ready. But here we have Dr. Huang Yi, who's an associate professor at the Department of Laboratory Medicine here at Sichuan Provincial Hospital. Welcome again, because you joined our TV show at noon. Dr. Huang.
Don't be worried about that. So this lab is not in use right now.
Okay, it's not contaminated yet.
Don't worry about that.
Okay.
Yeah. So right now we're doing some modifications. Just the software, the hardware, and something else. Just in this lab, and this lab will be run just next week, just maybe Tuesday or Wednesday. And this is designed specific for the fever clinic patient. Yeah, just right out there in that building.
Okay, so at the TV show at noon, we visited your old lab, right?
Yeah, exactly.
Why is it necessary to have a new one and in a separate building?
Basically, according to the government rule, we have to design this kind of areas specifically for the clinical laboratory. And you know, you can just surround, you can look, check it out here. We have a lot of machines here. We can do basically all the laboratory tests in this lab, just not in our main lab, just in that building. So this lab is just, you know, we can just detect the SARS-CoV-2 IgM, IgG antibodies and the nucleic acid test just right here. So this will be very fast, and for the fever clinic patient, and they will get the report in 2 hours just right here.
I hear IgM, IgG all the time. Those are basically two kinds of antibodies that you will have if you have been infected with COVID, right?
Yeah, just at the very beginning, just maybe approximately just from 7 days of infection, the IgM antibody will rise, and after that it will decrease, and after that another antibody, IgG, will rise. It will last for maybe several months or several years. It depends on the situation of the patient. That's different. Yeah.
Okay, so can you walk us through the lab and show us the different kinds of equipment, because they look, I mean, for a lack of better word, very cool.
Yeah, this machine is for the hemostasis analysis and hemostasis. And that machine is for the, you know, the liver function, the kidney function, that and for the, you know, cardiovascular,
liver and kidney function.
Kidney function and liver function, and we can do some other just cardiovascular disease related just test from here. And this machine, we can use this machine for determination of the antibodies. IgG, I mentioned that IgG and IgM antibodies use this machine. And then those are just machines, just that, you know, that's very tiny machine. That's for the critical ill patient. That is called the ABG, arterial blood gas analysis.
Okay, so from now on, I'll just pretend that I understand what you're talking about. I know it's already a dumbed down version.
Yeah, this is for, you know, just, if we, can I just say Chinese? No, right?
Well, if you speak in Chinese, I don't think I'll be able to translate it into English.
Okay.
I probably wouldn't be able to even understand the Chinese.
Yeah, sure. This is for the CBC, the cell blood.
I know, I'm giving you a hard time. Just tell me what it does.
It does. 血常规, you know that? CBC. CBC, different.
Well, I've heard of the term, but I don't know exactly.
Cell counting.
Okay, cell counting.
Cell counting, and that machine is used for a urine test.
Urine test.
And the stool test out there. Just this one is for the stool test. Just excuse the mess right here.
And these are all for analyzing the samples from COVID-19 patients?
Actually, it's not just designed specific for the COVID-19 patient. Just actually, if you just go to the hospital and see the doctors, and these machines also are useful. Right. Just according to the rule, these are just you know, for the laboratory, we can meet the basically requirement for diagnosis of SARS-CoV-2 for a COVID-19 patient. Right. Just use all these kind of machines.
So at this special moment, special period of time, it's used solely for COVID-19 purposes.
And just the, you know, the machine out there, that tiny one. Oh, not one, just two. We have 4 machines right here, right there. They're just for the rapid amplification for the nucleic acid, just right here. You can get the result within 2 hours. Yeah, just as I mentioned. Yeah.
So how many samplings do you do nowadays?
We hope probably get less than 100. You know, that's just confined to the fever, just you know, the fever clinic patient, not for the other kind of patient from outpatient or emergency. This is only for the fever clinic.
Right. And since you're with the lab department, how fast can you usually get the results?
You mean
the nucleic acid test results?
Within 2 hours.
Within 2 hours.
Yeah, exactly. Within 2 hours. Just use this kind of machine is very super easy for you. Just add the swab samples inside the tube and add the magnetic beads, just a small tube, and add that inside the tube, and then add the swab samples also inside the tube. Then just cap the tube, insert the tube in that machine, and then just wait for 70 hours. You can read the results and then send them to the clinic. Yeah.
Wow. Okay, 2 hours. That's quite an improvement from before, right?
That's a different method that's called the isothermal amplification, not just we typically mention the RT-PCR, real-time RT-PCR. That's a little bit different.
Right. So, lab physician, you're behind the scene. You're not on the front line, but equally dangerous because you deal with samples and all that things. How do you feel about your own safety?
I don't just worry about that so much because I have to do all the protections very well and just trust science.
And just wanted to pay our respect to all the medical workers like you. You're the heroes who got us through COVID.
No, nobody is the hero. We're all ordinary people, and we're just doing what we should do right now. Yeah.
Thank you so much, Dr. Huang. And with that, we come to the end of this edition of our live stream. We're at Sichuan Provincial People's Hospital, which is one of the largest hospitals here in southwest China. We're going to be standing by in the coming couple of days to update you on the COVID-19 situation here in southwest China's Chengdu city. So thanks for watching and stay tuned. Goodbye.